on Saturday evening, I got a phone call from a very well-respected colleague, a professor of surgery at the University of Ife, about a 33-year-old woman in Alimosho. I'm not sure exactly where Alimosho is, but she had had surgery to remove her gallbladder, and unfortunately, there was an injury to her hepatic artery, and she's been bleeding significantly since then with blood transfusions. This is Dr. Hamed Ninalo with IRDoc Nigeria. I at Eurocare on June 19th, Sunday morning. We're here this morning with the IRDoc Foundation to take care of an indigent patient who had surgery this past week, had a laparoscopic cholecystectomy, which is removal of the gallbladder, and unfortunately has been bleeding from the stomach since then, secondary to an injury to the hepatic artery. We've just done a CT scan downstairs, proving where the injury is from, and we're about to go to the cath lab. So the Interventional Radiology Foundation is a foundation set up to provide emergent interventional radiology care to patients who cannot otherwise afford interventional radiology care. And our mission has always been to be able to provide care for especially young patients who are in dire need. And we know that the only service available to provide this life-saving care is interventional radiology. And we've set up this foundation for about 3 years now. And we've taken care of a lot of patients, and we should be taking care of this young 33-year-old female this morning. So we have just done a CT scan and clearly see exactly what the problem is here. So this is the proper hepatic artery, the artery that feeds the liver. The left hepatic artery has gone up already. And from the right hepatic artery, there's an injury to this artery, and you can see there's a big ball, very nasty, something called a pseudoaneurysm there, which has caused this lady to bleed significantly for the last few days. Alright, so we got this done. This is the celiac artery here, this is the gastroduodenal artery, left hepatic artery and right hepatic artery. And this is the tear in the vessel wall here causing this pseudoaneurysm, and this is what's been causing this bleeding for the last few days. Essentially what we've done here is now we've gotten a microcatheter across the level of injury in order to start the treatment. So this is after treatment, and what the treatment entails is basically blocking the inflow and the outflow of the pseudoaneurysm, so blood flow cannot get into that aneurysm sac anymore. If you notice, we've sacrificed the right hepatic artery and we've let the left hepatic artery take over the functions of the right hepatic artery, so there's still blood getting to the right hepatic artery from the left hepatic artery. And as you know, the liver is mostly fed from the portal system, so 80% of the blood to the liver still comes from the portal vein, so the liver should still stay alive.
My name is Adekola Adedamola Idris. My wife's name is Adekola Kende. Before we came here, she was bleeding, and so the hospital we were before, they refer us to this place through the Interventional Radiology Foundation. Normally, the charges for what we are here for should be 3.3 million naira, but we are asked to pay what we can afford, and we paid it, and the surgery was done and it was successful. Thank God for the foundation, because they really tried. They took care of my wife, and I really thank God that everything went well.
What we have done quite well in the last couple of years in IRDoc Nigeria is make sure that everyone in the country, public institutions and private institutions across the country, know that interventional radiology is available when patients have bleed profusely from an injury to a vessel within the body, as this specialty is as a unique place in stopping bleeding within the body without significant morbidity to the patient.